Um, and are we able to see my slides there? Fine. I'm assuming we can see the slides. I don't hear you anymore, Ray.
You do not, because I have so many windows open that
Okay.
I gotta find the window you're in.
I hear you. I hear you now. I hear you now. So
Okay, yes, I can see your slides just fine. Thank you.
okay. I will jump in. I'm presenting today on sickle cell trait, what you don't know can hurt you, also known as benign or not. Um, this is the As One Foundation is the organization that I've been working for since 2010. It was established by the young man there on the right of your screen, Devar Darling. And as Ray said, our mission now is to empower families globally, delivering life-saving sickle cell education. Our name comes from the story of surrounding the birth of Devard and Devon Darling, who were born in Nassau, Bahamas. Throughout the pregnancy, they were expecting one baby and were surprised that Devon followed Devard down the birthing canal. Throughout the pregnancy, they had been hearing two hearts beating as one. Unfortunately, though, they did move to the United States and go to school in the suburbs of Houston, Texas, where they were recruited nationally to play football at Florida State, which is where they learned that they had the sickle cell trait, but they were advised that it was nothing to worry about. It was benign. Just they were warned to avoid the 25% chance of birthing a child with sickle cell disease by not procreating with someone else with sickle cell trait. But on February 26, 2001, they were in a workout, a conditioning workout, where they were coached that their body is amazing. You'll pass out before you die. And Devon did, in fact, pass out multiple times. He was being carried through 61 of the 62 drills that they were going through that day to prove that they were physically fit. And he passed out and died that day. His death certificate says that his cause of death was exertion and dehydration complicated by sickle cell trait. So what is sickle cell trait? We know it's not sickle cell disease. It is still a genetic blood disorder that can be diagnosed by a blood test. And we have universal newborn screenings here in the United States for sickle cell. Usually when a person born with sickle cell disease is diagnosed, they are automatically referred to a CBO, a hematologist. But the process varies for those that are born with sickle cell trait. Most states are issuing a letter. And we also know about the inheritance pattern and the protection from malaria. Why does this matter? Because anybody can be affected by sickle cell and sickle cell trait, specifically those born of African, Caribbean, Asian, Indian, Latin, Italian, Irish, Mediterranean, Greek, or Turkish descent. We know that African American or Black Americans are overrepresented, disproportionately representing the majority of people with sickle cell trait here in the United States. The next highest population is our Latinx brothers and sisters, but the numbers are similar amongst our East Indian population. The bottom line for us is that everyone should know their status. It's not a skin color thing, it's a bloodline thing. So regardless to your blonde hair and blue eyes, you know, it's a funny story I could tell about a young man who is blonde and blue-eyed who found out that he had sickle cell trait white by the fact that his kid was born with sickle cell trait. And as far as he knew, he was all white and ended up having to contact his grandmother who lived, you know, kind of off the beaten path and wanted to leave stuff under the rug that had been swept under the rug, but he in fact did have it. What we're here to discuss today is the myths associated with sickle cell trait. Is it benign? Is it something that only affects African Americans? Is it truly nothing to worry about? We're also going to question the stigma and the attitudes about testing amongst athletes that have claimed that athletes feel marginalized and don't want to know. So the trusty Merriam-Webster tells us that benign means a mild type, does not threaten health or life, not cancerous. That is one description of sickle cell trait, benign. Another often used word is asymptomatic, which also means not causing, marked by, or presenting with signs or symptoms of infection, illness, or disease. But this list, and unfortunately it is a growing list of complications. I'm going to try to move this. You probably don't see it, but that make sickle cell trait not so benign. We're going to go through each of these very briefly, and I do reference the resource, at least one resource in the research that correlates sickle cell trait to these complications. Chronic fatigue. This is probably the biggest one, the most reported. Tired for no reason, slower or prolonged fatigue compared to others, such as in a team sport. I've heard professional athletes refer to their situation as, guys are long gone from the locker room and I'm still in there trying to get myself together. Chronic fatigue. Splenic infarction. This is caused by high elevation, where you can experience chest pain, a sudden onset of left side abdominal pain and nausea. Again, this can happen when flying, and this has definitely been reported among sickle cell trait warriors, or sickle cell trait carriers, as we say. Invasive pneumococcal disease, pneumonia. This is pretty regularly reported as well. Venous thromboembolism, blood clots. Sickle cells clot. So this is another one that is correlated to sickle cell trait. Yes, the amount of sickle cells in the blood of a person with trait or traits of sickle cell is less than that of those living with sickle cell disease, but blood cells clot, and wherever you have blood, you can experience clotting. Retinopathy, we know we are constantly advising our warriors to get eye exams to detect retina damage, but this is the same warning that should be given to those living with trait. The kidney connection is a vast area for our trait warriors, because anything from adult bedwetting to blood in the urine to rhabdo, which can be experienced by people who have no sickle or no S gene in their blood, but renal medullary carcinoma, also known as RMC, is a pretty concerning condition that statistically only affects people with sickle cell trait. Recent research is correlating it to exertion, dehydration, and sickle cell trait. But RMC is a very rare but a fatal cancer that is usually resulting in death within 1 year of diagnosis. There are some milestones that are happening that is causing RMC people to live longer, but we still have quite a long way to go. And as far as the knowledge, we have way long to go, because most people don't even know that this is the case. And the only way to be diagnosed is through a kidney ultrasound, but there is no preventative ultrasound available automatically. I mean, I would want any trait warrior to get your kidneys ultrasound every year, but currently that is not available. But if you think, because what I've been told is if you already have blood in the urine and flank pain, then the tumor is already there and is likely too late. But absolutely advocate for regular or at least annual ultrasounds of your kidneys. Acute chest syndrome, again, something regularly happening amongst our warriors, but has also been correlated to those living with trait. Avascular necrosis, again, this happened, I have heard this happen, to be described as cramps or hammies in athletes, when in fact we're dealing, and what I have here is growing pains. Well, I've spoken with 48-year-old women who probably aren't having growing pains with sickle cell trait. They're probably experiencing some level of necrosis, but it's discounted because they're only trait warriors, as you know, in quotes. But this again is a concern and has been reported as a correlating condition of sickle cell trait. And exertional sickling. This is one in particular that is of extreme importance to us at the As One Foundation, because it is in fact what took our founder's identical twin brother, exertional sickling. There have been quite a few other athletes, too many actually, that have died the same way. And we have a simple solution that we offer to prevent this. Okay, COVID-19, oh my goodness, we seem like we get closer to that finish line and the needle moves, and we get closer and the needle moves. But the fact of the matter is respiratory issues, blood clotting, all of these issues present at a higher rate for those, potentially for those living with sickle cell trait, and have been recorded in the research as such. I encourage you to screenshot this and do your own research. There's been concern about vaccines versus no vaccine. What risk, and I know that there are people that, because they live with sickle cell trait, did choose not to vaccine. But all the precautions that our warriors take, we advise that our trait warriors take as well. So back to the exertion. Again, this is what took Devon Darling and too many others. Usually it happens in most of the cases of these athlete deaths. It happens at the beginning of a conditioning workout on the first day within the first hour. This makes the sickle cell trait exertional sickling classified to be the #1 killer of collegiate athletes, the #1. The fact that this is happening after a brief but very high intensity workout associated with pain that will take an athlete to the ground, as you can see demonstrated in this picture, but is still often confused for cramping. And if not addressed immediately, then too many times it results in death. So the NCAA has intervened, because at one point there was no sickle cell trait mandate. There were subsequent deaths that happened, such as Devon's, Dale Lloyd's, Eric Planter, and so many others, that out of not necessarily trying to save the lives of athletes, but out of protection for the universities that had been sued by the parents of these young athletes to mandate testing, and then a subsequent death. The parents wanted their son's life, Dale Lloyd at Rice University, to be even more impactful. So the mandate was expanded to not just Division I schools, but all 3 divisions. The education is there. There's an 8 to 11 minute video that's there that, they sit in front of the young athletes to watch. But again, the deaths continue. So that's why the As One Foundation exists. And we are so appreciative for opportunities like this to educate the public, hopefully a parent, hopefully a coach, a school nurse, or someone that can take this and say, hey, we need more, we need to learn more, we need to do more. So the exertion, of course, has risen to the top as a main risk factor, a very important risk factor when it comes to sickle cell trait. But dehydration and elevation are also, they kind of round out the 3 main risk factors associated with sickle cell trait. With dehydration, of course, we are advocating that you drink half your body weight in ounces of water per day, half your body weight in ounces of water per day. When I'm in person and I ask people to raise their hands, if you have had half your body weight of ounces of water every day this week, most hands don't go up. And then I say, okay, so if you have not done that, then that means you're dehydrated. How many folks are dehydrated in here? All the hands go up. This is important for all of us, sickle cell allies that have no S in our blood, to our disease warriors and our trait warriors. It is especially important when it comes to our trait people that exert, whether you're in collegiate athletics, you're a dancer, you're a cheerleader, you're in the marching band, you are pledging, some of us that pledge sororities and fraternities, engaging in that level of physical activity, or you could just be, attacking a bucket list item. I want to run a marathon, or, I want to go and do an Ironman where I swim and bike and run. Exertion is okay. You just have to properly prepare, and hydration is so important. A little more about that here. Again, I talked about the sickle cell trait being the #1 killer of collegiate athletes, and here are 6 of too many young people that died as a result of their sickle cell trait. But it doesn't end there. Unfortunately, there's been Pop Warner, little kids, 11-year-olds through high school. This is not reserved to just football athletes. This is not just reserved to male athletes. This is something that can attack anyone that engages those risk factors without the protection. And if you see there to the extreme right, Carson Cross, a young white male, died. I believe it was his first day of football practice in high school. Within the first, he fainted, he passed out and died on that same day. So what we have is the newborn screening that, as we referred to earlier, does alert parents of people living with sickle cell, babies diagnosed with sickle cell trait. But the letter says it's not disease, they'll live a normal life. They give that, brief family planning advice, but basically leave them feeling that there's nothing to worry about. And I am not advocating for you to worry about anything. I'm advocating for you to know and have your knowledge so that any decision that you're making is an informed decision. But now what? Should this be being discussed during childhood? Because what happens to that letter? Goes in the drawer in the kitchen. Everybody had that junk drawer. And if you don't get a letter, there are some states that don't even provide a letter. I know our Canadian nations don't even inform people diagnosed with trait. They only reach out to those diagnosed with disease. But what's the parent's knowledge? What's the child's knowledge? Are there any other access and opportunities for screening? Is there another mandate? The only next one is if they go and play NCAA sports. And by the way, all sports played in colleges in America are not classified as NCAA sports. The mandate does not exist for NAIA. And unfortunately, young athletes continue to die preventable deaths. So just to bring this on home, there are 3 conversations currently that raise the screening conversation at diagnosis, at the newborn screening, if you play NCAA sports, and unfortunately after it's too late. That's either after a hospitalization or a fatality. But we propose, never introducing a problem without some solution, that there's 10 opportunities for the conversation before birth at family planning. I heard a statistic, I don't remember the exact statistic, but Black births are majority unplanned births. They are, we got pregnant births, unplanned. So, but even if, so that could change and could make things better, but before the birth happens, planning, before the pregnancy happens, family planning is an opportunity. Genetic counseling, which could take place during that family planning. Of course, at the newborn screening diagnosis, here's an opportunity to have this conversation about the risk factors of sickle cell trait. More sensitive testing. We have the Red Cross that is offering testing. Sickle cell testing along with blood donations, which we need, but the testing that they're using is not very sensitive, so we need more sensitive testing. In-school testing and education. More about that coming. Transitioning from peds to adult care, absolutely. dating, sex education, and this is not linear. This can be happening all, overlapping and everything through. Of course, the NCAA sports opportunity, but what happens in October every year? The world turns pink for breast cancer. That is an example of universal education. Everyone's not going to have breast cancer, but all of us are being educated about it. And of course, the recruitment of sickle cell allies, those people that live with no S gene, they have no sickle in their blood, they may not even have a family member, but they care enough to talk about it, share it, donate to it, donate blood, all of the above. These are 10 opportunities to engage with everyone about, sickle cell trait in the conversation. To drive home the hydration, these pictures are pictures of this. Up here is young kids that I actually took this picture when I was in school of young people working out, seemingly engaging in physical education. And I took a walk around the perimeter. There's tables over there. And what I observed was no water. There was no water fountain, no water cooler. Now, I can't speak for if the coach had water in the truck, but if young people are out here playing and engaging, I want them to have water nearby. Because why? Why do we water our plants? Why do we put water in our cars? Why do we give water to our pets? To prevent our plants from dying, to prevent our cars from running hot, to prevent our pets from getting lethargic. Well, we need to water ourselves to prevent dehydration, sickle cell or not. It's just the best practice. Great skin, great hair, great elimination, great for our health, great for blood flow. There's endless benefits to hydration. So I listed the risk factors, but I'm going to talk now about the protective factors. So we said elevation, exertion, and dehydration are the risk factors. The protective factors are to go from gradual intensity to intensity, work your way up to it. Hydration, again, half your body weight in ounces per day, before, during, and after physical activity. Remember that picture of the young people? We want them to have hydration right there so they can take a sip and keep working. Recovery breaks, often. Not these conditioning workouts where you're running for 40 minutes straight with no break. When you're conducting suicides, which is a real workout in basketball. Wonder why it's called suicide. But anyway, gradually intensify to exertion, hydration before, during, and after, and recovery breaks. In other words, warm up, drink up, and rest up. Very, very simple. Exertion, dehydration, elevation. Protection is warm up, drink up, rest up. Go from that, rest to exertion gradually. Drink up, hydrate before, during, and after. Half your body weight in ounces of water a day. And rest up. Rest up means take a knee, raise your arms above your head, get some air in your lungs. Don't go 40 minutes straight without a break. And here, just for anyone that wants to screenshot some of the resources of these adverse health effects and the associations. But we do have some barriers here, one of which we're knocking down today because we're providing education that's going to be shared and remain on the websites for you to access at your leisure. But in defense of the doctors that unfortunately have left our patients feeling not believed, feeling like they're crazy, provider training is meaning the curriculum of a typical medical school is the equivalent of 5 minutes spent on sickle cell trait. There, of course, is the stigma of associating weakness, water with weakness, needing hydration with weakness, or just being a trait warrior as an inability. And of course, I've seen this associated in a household where you have a warrior and a trait warrior sibling, there's guilt. So minimization of any conditions that they may be suffering because of the warrior sibling. And of course, the rare designation. It's rare. So if it's rare, does it mean it's discarded, is overlooked, is not paid attention to? I think not. But we have plenty of opportunities, testing in high schools, surveillance, research funding, therapies. And I'm happy to say that every one of these are increasing. Every one of these bulleted items are increasing, but we still have much more to do. Just a brief slide about the research that I actually conducted for my dissertation, taking a social ecological examination of sickle cell trait knowledge, perceptions, and beliefs amongst coaches, trainers, student athletes, and their parents at a Florida HBCU. We did a consensus of the entire athlete population, majority of the coaches, some parents and trainers, to get an idea of what their knowledge was about sickle cell trait perceptions and beliefs, and came away with some interesting focus group direct quotes when asking the student athletes what they know about sickle cell trait. And here's just a few. I won't read them all, but I don't know much about it. I just know I have it. My mom has it and it causes my iron to be low. That's one thing that a student athlete said. I've taken multiple different surveys on it. It's not just yours, but others at my school. Sometimes surveys try to make athletes aware of it, but the only reason I even know about it, I think we had to take a test for a physical, I think. When asked, what is this question saying about their knowledge about exertional sickling? What's that? Never heard of that. When you get tired, it gets worse. The last quote, is it like when your blood vessels don't go through your bloodstream properly, like they don't fit through properly? And who should be tested? This was a question that was asked of all the focus groups, but student athletes said intramural teams, fraternities, sororities, dance teams, cheerleaders, theater, dance teams, everyone college-wide. This first quote, not just athletes, because they're not athletes. They should be included. Just because they're not athletes, they still should be included. They're not students. There are students over this whole campus who are not athletes, but they still work out, or they go to the rec room. They still work out. They are all walking. They get tired. This is a big campus. It is important for them to know. Band practices for hours and hours out there in that heat, just like the rest of us. And these are young college students, young collegiate athletes that are saying everybody should be tested. The bottom line of that research conclusion is that education is desired, needed, but not widely available to prevent the adverse health effects. Student athletes not only desire the education, but field testing should be available to all students. Student athletes expressed no threat of stigma from a positive diagnosis. They specifically said, if my teammate is out here in the field, that means they should be here. They didn't see it as anything different as needing an asthma pump. And they also expressed a need for care and concern of the non-affected allies. As we like to say at the As One Foundations, all humans have a genotype, even if it's AA. Find out what yours is. AA, by the way, is 2 copies of normal hemoglobin. But everyone has a role to play, and even if that is a sickle ally, meaning you don't have S in your blood. And this is just a resource that we put together for parents of young people with sickle cell trait to take to your schools and you can download that from our website to show the coaches the importance of what we're saying with warm up, drink up, rest up. And this is how you can reach us. And by the way, I'm going to put a link in the chat that because we are educating parents, we're educating schools, we're educating the world as much as possible, but we have now started to educate the provider. The link that I just put into the chat, I think that I just put that there I'm going to put it in for everyone, is for a CME, a continuing medical education opportunity for your doctors, for your nurses and medical providers to get a more comprehensive version of what I just gave you. Way more information there to help raise their awareness so that our parents are not feeling crazy when they're going to the doctor and saying, hey, my kid is suffering. And their training is telling them, yeah, but your kid only has sickle cell trait. They're not supposed to be having any issues. And in fact, they are. Well, this CME coming up on August 19th is one opportunity of 5 hours to have your doctors educated about it. And we will be opening it up for a free registration for our community members to be real soon. It's not available now, but it will be. We will definitely invite our community members to participate free of charge, but our doctors and nurses, a nominal fee for education so that we can increase the quality of life for our warriors and trait warriors.
Wow, that was fabulous. So before we get into the questions and my responses, I want to make sure, because we are a nonprofit, that means not for profit. So let me put my disclaimers out there. We are not an extension of your physician or your medical team. We are sharing information, sharing knowledge. We are not diagnosing or anything like that. So it is important that you have this conversation either with your hematologist or your primary care provider, but someone on your medical team, and encourage them to do more research on it. So now that I've said that, because the only thing you're going to get is a dog and a computer. So, I do want to just say, someone was asking for that link again. I thought that I put it in there, but it says that the form is not available. Okay, so we have several attendees. I am so excited about this topic. Let me tell you a little bit about why this topic became, it's always been important, and I've always wondered in the back of my mind. But as you know, there is, if you bring this up in a medical setting, you know, they downplay it and they dismiss it. And I attribute that to the lack of education, but I also attribute the lack of education to the lack of research. You use the word several times, potential. It has the potential to this or the potential for that. And typically when I hear the word potential, what that says to me is, well, we need more research. And no different than in sickle cell disease, sickle cell trait research, we can barely get enough for sickle cell disease, let alone for trait. But I want to say that, especially considering the fact that so many of the population have that trait, it is probably one of the most common hemoglobinopathy traits that is found globally. Not even in America. As a matter of fact, we score lower than many other countries where we see sickle cell more dominant. So what can we do to increase funding dollars for sickle cell disease and sickle cell trait research, specifically this sickle cell trait? We've got to learn more.
Well, Ray, that is the 1,000-leg table that I always talk about. We have to hit it from all angles. I'm told that the Naismith report does include sickle cell trait education in it, and I consider that a success. When I came into this space, sickle cell trait was barely and sickle cell trait at the end of the sentence. It was barely that. So now we're seeing more and sickle cell trait at the end of the sentence, but we're getting more and more opportunities like this to talk with audiences like that of yours.
Wonderful.
But we have to continue to speak up. The caregivers that are caring for our warriors are likely trait warriors.
Yes.
So their voices as the caregivers, when I speak to farmers, I'm telling them you're missing an audience, because that caregiver, a word that we use a lot in this day and age is influencer.
Yes.
Kim Kardashian, Shaquille O'Neal. Oh my God, he has huge influencer power. Well, the caregiver is the number one influencer. So we need our warriors as much as our caregivers are battling. I know I don't have to tell you, battling for our warriors, we also need our caregivers to speak up about the trait education, the family planning, the need to know the tweaking that's needed for these medical school curriculums, because they're going off of what they're being taught. We need it corrected. There's even a research that shows that ER physicians don't want to treat sickle cell. They don't want to because they don't know enough. So
Wow.
all of that needs to be addressed because, as you said, there's to the 100,000 warriors here in the United States, there's about 4 million
Wow.
living with trait. And honestly, I think it's more than that because the surveillance is old. And, you know, that means the potential of more and more sickle cell births, of course. Every child of a warrior, every child of a person living with sickle cell disease, a natural offspring, will at least have sickle cell trait. So we're constantly making our population without the knowledge that we need to address our population. That has to change.
And you're absolutely right. So a couple of things that validate this for me. And I, as a leader in the sickle cell community, and certainly here in the state of Minnesota with the Sickle Cell Foundation of Minnesota, we have not done enough to talk about sickle cell trait. And that's why I have you on our Living Sickle Smart, because we do want to do more. And you have a platform there, you have a niche in the CBO or community-based organization world, and it's going untapped. And so we want to make sure that we do more education. Our sickle cell disease brochure includes sickle cell trait brochure, but we need to update that so that we either add more information about what can be done, or we need a separate sickle cell trait brochure because we're at tabling events and community. But here's the thing, because what concerns me is that we create a pandemonium.
Yes.
Right? We create all of this worry. But one of the things, so I have two thoughts on that. The number one thing is that if sickle cell trait is important enough for the NCAA to implement a policy that you must be tested prior to participation in collegiate sports, that validates it right there. Right? Yep. Yes, we need more research, but they felt strongly enough, and there was enough even basic information to link all of these deaths to say, okay, we don't want to get sued, right? I'm sure they have been. But so that in and of itself says we should be looking into this more. And when individuals come to me and they talk about sickle cell trait and they talk about their concerns, one of the things that I do say is, that the same thing that I tell warriors, we are a whole person. And so keep in mind that not only can it be sickle cell disease or sickle cell trait, but make sure you're getting a thorough checkup so that you're not overlooking other things that it could be. And we rule those out until we have more research, until they have no choice but to listen to us. So we have lots and lots of questions. And I know you and I could talk forever.
Yes.
And so I want to get to people's questions. And please know that we will do our best to get to your question. If there is a repeat question or it's slightly different, we apologize. We probably won't get it twice. We got about 12 questions in here. Okay. And then we may not always have the data or the specific answer you're looking for, but we will address your question. So the first one is, what percentage of people with sickle cell trait have sickle cell crises?
Oh my goodness, that is an excellent question that I have no answer to because we do not have the surveillance. I didn't say it, but sickle cell trait does not have a cause of death code. So that's a big clue. I mean, it's like a flashlight, a bright spotlight on the fact that we don't know all of the actual deaths associated with sickle cell trait because they are classified to the secondary condition. Devon's, his death certificate says dehydration and exhaustion complicated by sickle cell trait. Often deaths associated with sickle cell trait are heart related, definitely exhaustion, a lot of heart, like I said. So it's not a real way for us to know at this moment because there is no sickle cell trait cause of death. And by the time you try to examine the body after death, all oxygen has been exhausted. So and we're even adjusting for like the athletes. We've adjusted for the fact that the statistics are 1 in 8, 1 in 12 people of African descent. So if you take that statistic and adjust for the population and then adjust that to the population of athletes that are of African descent, we come up with a very loose statistic of approximate 18% of all pro athletes. That's just pro athletes.
Wow.
But that's a big percentage. Now,
well, and those athletes that have trait are also those influencers that can
ding, ding, ding. Yes.
Right?
Yes.
Okay, we got a lot of questions, so we're going to keep going.
Okay.
And then the other question was, my son with sickle cell trait has a low hemoglobin. Is this normal? And what is normal hemoglobin? I'm not even going to pass this to you. We don't know.
We don't
need
know.
more research.
We do not know.
We don't have the data, and that's part of the challenge, is that until we have data. I used to tell, when I was in the clinical setting, I would say it all the time: no data, no dollars, no dollars, no research, no cure. So in this case, we cannot find out about any of these things until we get some data, so we can get the dollars to do the research. But we also have to be speaking up. We have to kind of turn the light bulb on in our care teams to make them want to learn more and keep asking those questions. Okay, let me keep going because I can keep talking.
Okay.
As a project director, how do we inform the education? I'm not sure if it's saying inform or uniform. I think it's a uniform, the education across the board. Are these students losing scholarships if they're diagnosed with trait or disease? I love this question.
The answer is no. Well, disease, they're likely a disease athlete is not a scholarship. A person living with sickle cell disease is not a collegiate athlete. Those living with trait, there's plenty. And on the collegiate level, the pro level, I mean, there are a lot of pro athletes that have, I'm talking about first round picks.
Yeah.
I'm talking about excelling. You can play with sickle cell trait. You just have to warm up, drink up, rest up. And
but I do think that the consistency of the information needs to be there, because we can't continue to just talk off the top of our heads. What we do know, we need to get into some sort of form that is consistent. The SCDAA, as well as the NCAA, they do have fact sheets around sickle cell disease. I think that those need to be consistently updated as we learn more. There also needs to be a call to action on those so that we can get more research done. And then when you ask about students losing scholarships, that was the reason that there was, and correct me if I'm wrong, but one of the reasons that the NCAA subjects all athletes to that is so that there would not be bias against individuals who are typically of African descent that would be unable to play, or that it would identify them in some unfavorable way. And so one of the best ways to do that is to make something universal. Listen, when the newborn screening first came out, what did they do? They only screened Black children. And then they realized they were missing, even if it's a small number, they were still missing babies because they were targeting a population rather than the human race. And so we had to do that. All right, next question. Is insurance coverage being impacted to families of trait patients? Just a short answer to that. What do you think?
No, I'm not aware of any insurance issues.
And I am not either. It's not a question that's being asked, and frankly, it's not in most people's problem list. Sadly, so many people don't know. So even if it was in a problem list, it's highly unusual to see that there. You'll see sickle cell disease, but rarely will you see sickle cell trait. And then how do we initiate or start a conversation with our healthcare providers that as someone with the trait, that my pain and chronic fatigue could be attributed to symptoms of sickle cell trait? I kind of answered this question in the fact that they're going to want to rule out everything. And once they send you to this doctor, that doctor, the rheumatoid doctor, the internal medicine doctor, now you've crossed all those off the list and you're still having pain. And I would simply say, we may not know much about sickle cell trait, but what I'm asking is that for you as my medical team, my medical provider, that you look more into this. I'm not asking you to agree, and I'm not asking you to disagree. I'm asking you to do more research.
And the needle is moving with the higher the education. The NFL, knock on wood, is not killing athletes. There are collegiate athletes that are being lost. High school, there is no mandates. There are no regulations. And so unfortunately, that's where we're having a lot of disparity, and even younger. So taking the example, the athletic trainers know this, but when you come to a collegiate system where the coach is God and the athletic trainer is not God,
yep, that's the coach.
The coach can kick the water out.
That's
you know, the coach can kick the trainer out.
Yeah, and I also think that if you have kids with sickle cell trait, particularly, that you should be demanding that they are allowed to bring their water bottles. No different than if you have sickle cell disease and in the classroom setting, they should have access to water and the bathroom.
And bathroom breaks, yes. Just a kid needs an asthma pump, a kid needs a water bottle.
That's exactly right.
That's what's needed. Yeah.
And then the more that we are talking about it, that's how you keep the conversation on the front of the burner, not on the back of the burner. So it happens from a grassroots on up. I think that we have all learned some lessons about how medicine is handled in the US. And so we have to put the demands out there, because they can do it when they want to, and when they decide to, and when they realize that it's a bigger problem that affects their backyards, then we start to see a shift. And so that's what I would
we got to act up. We got to act up.
Right. Don't act out, but you're going to act up. Don't act out.
Yeah.
All right.
Can't be quiet. Yeah.
All right. Is it simply flight that causes issues with elevation, or can they be affected by visiting high altitude places?
Yes. Any change to your elevation, deep sea diving, mountain climbing, flying, a tall building, any change to elevation can be risky for those living with sickle cell trait. You can acclimate. There are warriors and trait warriors that live in Denver that have acclimated and are doing just fine.
Listen, that's like the cold weather here in Minnesota.
Yeah.
That people say, you got sickle cell in Minnesota? Yep, we acclimate to the weather.
Yes.
So yes, you're absolutely right. And then, is there a connection between sickle cell trait and mental health issues, such as?
Oh, this is a good one. The short answer is yes. But like I introduced, guilt, there's even autism has been brought up as some of our trait warriors, a lot of our trait warriors that are on the autism spectrum. So the short answer is yes, but more research is needed.
Wow, what a question though.
Yeah.
And then should sickle cell trait warriors be seen by a hematologist? I have an opinion on that, but I'd like you to go first.
I want to hear yours, Ray. What is yours? I want to hear yours.
You can go see that hematologist. I don't know how much they're gonna know to tell you.
Exactly.
But if you are having complications consistently, then by all means, I would absolutely go for a consult. What I will say is that if you go to, I'm not saying that whether it's a primary care or a hematologist, I don't think that always, well, let me restate that. If there is any knowledge whatsoever, it would likely come through the hematologist and not the primary care. But we still know that there's a lack of knowledge. And so I would mention it to my primary care provider. And as I said before, I would encourage them to please do some digging. They have access to white papers and all kinds of other reports that are being done that we just can't see. So if you tell them you need them to dig a little deeper, then hopefully that's exactly what they'll do.
And we need more. I'm aware of hematologist champions that want to and have engaged in training the primary care physicians, the ER doctors, for what to look for, especially when it comes to this, because they're the ones that are likely to see them in the ER or in the family practice or what have you. So yeah, it's the hematologist is as you said, agree with you 100%, but we need more of the other doctors, because the orthopeds that they'll probably end up seeing for a hammy that needs to rule out blood. They need to rule out if this is a cell damage, bone damage.
And I know that we are at the 7 o'clock hour. I apologize. And if you need to jump off, we certainly understand. We're going to try to get through these questions. Dr. Austin, are you able to stay?
I'm with you.
Okay, I love this question by, this is actually a nurse in the hematology setting. And I will say the biggest advocates probably are the hematologists, because they are the blood specialists. So when we have those allies and we have advocates in the hematology space, they're heard with a different ear.
Yeah.
The question from the hematology nurse, hemonc nurse, is, do families tend to have challenges getting insurance to pay for testing for sickle cell trait?
I have not heard that as challenges. It's because it's simply asking, when you're doing your regular blood, you can just ask for the screening, because it's the same blood draw. What I am not seeing enough of is available testing, because we have newborn screenings here. The testing that we were using as a community-based organization in the community was SickleDex, which is not the best reliable test.
You need an electrophoresis.
You do. And those tests, if you're walking into like an any lab or LabCorp, that's approximately $45 to $50. So there is a financial disparity there. But the testing, there are no barriers to getting testing outside of just availability. But if you're in a regular visit, you can ask. That's usually not how it happens. So we have been in the position to just provide vouchers to local labs to go and get the electrophoresis.
And we are working on, here in Minnesota, we are working on partnering with, I won't mention who we are putting pressure on.
Yes.
But we are working on being able to implement that on some level, because we did not, in Minnesota, when I say we, Minnesota did not start trait notification for newborn babies until 2015, y'all. Okay. Sickle cell disease was added to the newborn screening in 1988. So it took how many years? 30 years before trait was added, and it's the same test, but you know, it was an education thing. So right, people with sickle cell trait have the highest risk factors for having a child with sickle cell disease. And so now it is, you are notified when your child has it. But these adults, these caregivers, these folks that can still have children, thank you, Jesus, that's not me. And but also think about the workarounds. What we really should be doing is sending more families for genetic testing. We're talking about sickle cell trait, but there are other risk factors that all people, need to be aware of. But in this specific case, so asking for genetic testing and seeing a genetic counselor, particularly if you have a child or children with sickle cell disease. And then the other workaround is go ahead and go on and donate blood. They'll let you know.
They sure will.
They'll let you know.
Will.
All right. All right. There's about 3. Oh, y'all still adding questions. That number went up. That's okay. We're going to be here and answer those questions. Are there any links of women with sickle cell trait and having a hard pregnancy? That's the first part of the question. And then how does AVN present itself in individuals with sickle cell trait? Is it similar to someone thinking that they have arthritis pain in their joints? Okay.
Question 1, question 2, answer 1, answer 2, yes. Yes and yes. Lots and lots of reporting that pregnancy is difficult for our trait warrior moms. I've spoken with the mom who said, I almost died. It almost prevented her from having another baby. And the reasons why vary, because as we classify our warriors as different as snowflakes, you know, symptomology is different. You know, one sickle cell disease patient is not going to present the same way as another sickle cell disease patient. That's the same for trait as well. Just because you have trait, you're not going to experience the same thing that a next person has living with trait. And to the point of arthritis, there's been an NFL player who was on one team whose trainer was aware of sickle cell trait, but they were continuing to treat him for hammies. He got traded to another team that had an athletic trainer that was really experienced with sickle cell trait and immediately diagnosed that the problem he was having was not a hammy. It was his sickle cell trait. His preparation needed to be different. And
Wow.
once they adjusted his preparation, similar to warm up, drink up, rest up, he didn't have those hammies anymore.
Yeah.
And I could absolutely see why some athletes don't want to talk about it, because if you're an NFL owner and you're a GM and you're saying, okay, this guy is injury prone, are they injury prone, or do they have a blood condition that you just need to, treat
Wow.
properly?
Wow.
So yes, the short answer, yes, some are, I know warriors that have the same pain in their elbow.
Yeah.
It's the same pain in their ankle. And they're being told, or they're believing, oh, it's just growing pains. Not if you're 50, that's not growing pains.
Right.
That's not growing pains. And it's not arthritis. It is cellular death, because the tissue death, what we know about sickle cell is these pains that our warriors are having, they're not having that pain and then it goes away. That pain now is the result of cellular death. Those cells are still dead. So
Yeah.
that's why you end up with the hip replacements. And
And it's not until we start asking those questions in the medical setting that we start to raise antennas and turn on lights. And even if you are dismissed, the more of us that ask, the more that they are going to say, maybe there's something to this. We can go down the history of medical care and why we need to make sure that we continue to advocate and use our voice. And then I believe you said that it was somewhere around, they believe, about 18% of college athletes that are testing positive for sickle cell trait. Is that correct?
Professional athletes.
Professional athletes.
Yes.
And is there a database that, see, they're not required to report that, are they?
No, this is NFL
So
data.
Yes.
They have trust me, the NFL, well, all of the professional sports, you've heard of a combine where they literally have these athletes, they're measuring their arms, they're measuring the width of their neck. So they know everything that's wrong with these. I mean, there's been a few cases where it went undetected, but for the most part, they know everything about these young men. But just think baseball, basketball, other pro sports, adjusting against the population numbers, which we still don't truly know. We come up with an 18% population of people with trait.
Okay. And I think that if we have some structured reporting mechanisms, that's that data that we need. And so that's the start of what we need to do, is wherever there are spaces where they are testing, that should be reportable. Yes. So that we can see trends and patterns across those spaces. I love this question, and I actually think there's some validity to it, and that is, should all hospitalized patients be screened for sickle cell trait, since they are, especially if they're doing CBC, so complete blood something, I forgot the C, y'all. But it is a CBC is a lab test. And if they're already getting blood, adding an electrophoresis to that, is that something to consider?
That is too easy. Yes.
Right?
Yes. They're already pulling the blood. I mean, if they're taking the blood, they can either take one more or just test it. And there's a sickle scan, which is not available to us in the United States for diagnostic purposes. It is available for research. The sickle scan is a finger prick, drop the blood. It tests for the majority of the hemoglobinopathies, 90+% accuracy, and results within 6 minutes. So that's another thing, on the burner, not quite the back burner. We're trying to have that available to us CBOs, because we still need to be out there testing. People still need to know.
Because something's better than nothing. SickleDex is commonly used in low resource areas. And let me tell you, community-based organizations are low resourced.
Amen. Amen. And that's why we were using them. But for the low reliability of it, we would still be using them. But I don't want to give people a false positive or a false negative. And that test only lets them know if S is present, not how much, and it's not testing for C or D or Monroe or Punjab or any of the other
Exactly.
Yeah.
So some of the other hemoglobinopathies.
Yeah.
Someone said that there is a patient in England that's a case study for major trait issues. And I'm not even going to put this as a question. This is more of a statement that I'm going to say, because absolutely, yes, individuals that have been identified to have major issues with their trait should be case studies
Yes.
for additional research.
Yes.
And there's more that exists than we know. And then would a focused medicalized trait, would a focus on, I got to come back to that. I have another one that says, I was tested in 1970 at birth for sickle cell due to our family history of sickle cell and sickle cell trait. So I always knew that I had the trait, but my question is for testing back then. Could someone be misdiagnosed with sickle cell trait and actually have the disease? Yep, I've seen it. I was in the clinical setting for many years. And yes, and absolutely. And then also just being a community-based organization, people tell us their lived experiences. Many of the late diagnoses is because they were told that they only had trait. I would also say, I'm going to extend that a little bit. A number of people who have a child with sickle cell disease, a significant number will tell you, but I was tested maybe in the military, or I was tested earlier in life and they told me I didn't have it. Can you say somebody didn't know how to read the results? So it's either that they took a low quality test that gave false positives or false negatives, or the person reading the results, God forbid, did not know how to read those results properly. So
that's why it should just be so much more readily available. Testing should not be, there should not be barriers to testing. It's just for family planning, for just knowledge, it should be more readily available.
Absolutely.
Because, I mean, especially if you're looking at those little blood spot cards that can get stuck together and it's off a little bit. And
and the least we could do is expand sickle cell trait notification to every state. It is still not part of every state, although sickle cell disease is part of newborn screening in every state. Again, it's the same test. What we need is a notification program in every state. Like I said, ours didn't start until 2015. But that can be done, and that's simple. And if you are a community-based organization, I encourage you to go to your state health department, the newborn screening department, and put some pressure on them and say, we need this. Why don't we have this? Ask questions. Ask your health commissioner. Ask your public health diversity and equity and inclusion and health equity. Whatever department claims that they care, make sure that you let them know that this is a high priority in our community. Health equity across the board. We know that there are varying outcomes in different groups. So we need them to know that this is one of them. And they won't know that unless we make our voices heard. And then, interesting question. I'm almost tempted to not answer this one because it sounds like a liability, but can trait or sickle cell disorder lead to multiple myeloma? I'm going to decline to answer that, and I'm going to recommend that you talk to your healthcare professional. That's a really steep question. It's a fair question. Don't get me wrong. It's a valid question. But there's a lot of varying research on lots of different things. So please go to your medical team and ask that question, and not the community-based organization with low research. And then one last comment before we go, and that is, my daughter is a coach now, and she makes sure all the kids get a test for sickle cell trait, and they check their heart as well. That's excellent. If you have kids that are playing sports, double check and see what they do. Also, like I said earlier, tell the coaches and the school staff or whomever that you want all kids, don't single out your kid, that you want all kids to have regular access to water. That means they don't have to leave the field and go in, at least have water out on the field. That's not difficult to do. And let me tell you, if I had a kid that was playing sports, bring a case of water. and
Yep.
make sure that that's available to the team, right? There's little things that we can do. And if somebody asks you, why am I doing that? Because we don't know who has sickle cell trait and who doesn't. And we know that exertion can cause complications, and none of us want to see that happen to our kids. They're too precious.
It's all preventable. And even with the testing, when you think about the collegiate programs, you have these Division I programs, you have Division III programs, the resources vary. And so the likelihood that the lower resource programs are using the high sensitive test is very low. So we still need standardization across that board also, because yes, the NCAA mandates the testing, but there's an opt-out opportunity. And if they're using SickleDex, because that's what's more affordable versus sending them to the health center or sending them, for a new test or what have you, then you still are setting them up for potential risk because the test is not reliable. So we need standardization. We definitely will take it because, like I said, high schools, there is no mandate, and we're just word of mouth, telling school nurses and parents to be that mom and be that dad that's showing up and saying, hey, but we need standardization across the board. We're getting there, but we're not there yet.
This is so good. I mean, people haven't even dropped off because this is such an important conversation, but I do want to wrap it up. I want to make sure that I let people know you should be seeing the shared screen now so that you can access the video. It'll take me about 24 hours to get the recording, but you can access it on our website. But I encourage you to go to our YouTube channel. And there you can see all of our previous sessions. And then if you do go to our website, poke around, see it. First of all, we just launched a brand new website on May 1st. So I want y'all to check it out.
It's beautiful.
And give me your feedback. Like this is a work in progress, and Ray is not a web designer. So if something's wrong, y'all let me know. And then we do have a quick links page through Linktree, so that if you're just looking for something quick, our most common things that people come to us to look for, not everybody has time to move through a website like that. And then if you want to be informed of future Living Sickle Smart sessions, you can go to our Eventbrite channel and be sure to subscribe. That goes for YouTube as well. Subscribe to our YouTube channel, subscribe to our Eventbrite channel, and we will most definitely make sure that you are informed along the way. A couple of the sessions that we have coming up that we're really excited about. We actually will be addressing some mental health issues on Thursday, the 23rd of June. These are just this month with Dr. Charles Jonasant. We'll hear more about his charisma program that he is starting over there. It's amazing, y'all. I encourage you. We do not talk. I was in a meeting earlier today, and I said, we know that sickle cell disease affects every organ of the body, and yet we won't talk about this organ.
The brain, yes.
Right?
Yes.
We cannot, or we have very limited conversations. So we have to first and foremost normalize conversations around mental health and what it is, what it isn't, and services that are there to really address that. If we go to a pulmonologist because our lungs have issues, why wouldn't we go to a specialist about our mind?
Yeah.
Right. And then another really good and exciting one on June 28th is on the correct use of IV fluids in a sickle cell crisis. Did you know that just general hydration is and what you should be using is very different than the hydration you should be using in a sickle cell crisis? If you're a medical provider, we invite you to join us. If you are a person living with sickle cell disease, or you are concerned as a caregiver, we invite you to join us, so that if your institution is not aware of this, that they can be made aware. And then check out that we had last month, we had two really good sessions on women's reproductive health, y'all. We're talking about the things that nobody else is talking about, and we're unapologetic about it. Most of y'all know Ray, and Ray's unapologetic about her opinionated self. And so we had a session with women warriors, and then the next day, it was a 2-day event. The next day we had medical perspectives on reproductive health and sickle cell disease with our local Children's Minnesota staff from the HEMONC department, as well as the women's health. and young girls' health. And if you are in the state of Minnesota, we want you to engage with us. We are all finding our new normal.
Yeah.
And so what that means is that we still take precautions, but we do want to interact with you outside of just a Zoom. We have a couple of events that are planned. What's really exciting, that's, hang on. What's coming up in only a couple of weeks is our slow roll for sickle cell. Last year was the first one. That is a conversationally paced bike ride. We only go about 5 to 7 miles an hour, and we have structured stops. As we are going along, we make sure that we hand out water at those stops, but then we also talk about some of the green spaces of North Minneapolis, and we talk about the social determinants of health, and how that is connected to some of the areas in which people live and are highly concentrated in Black and Brown communities, where we see worsened health outcomes because of those social determinants. So this is a really innovative thing we're doing, and we partner with Melanin in Motion. I love that name.
Nice.
But it's about getting us outside, y'all.
Yes,
Told us we don't go outside and do that stuff. We do. They even do bird watching, and that was for me. I was like, what? Nice. So, and then Walk and Talk for Wellness. This is a really nice small group event, and what we do is we just get outside and we walk. So that you are moving your body during the summer months. Minnesota, we only got what, 3 months of the best of the weather, so we have to get outside. So let's make it worth our while. Let's talk about health equity issues. I'll tell you in advance, we talk about the problem for 10 minutes, and we talk about community-centered solutions for 50. Okay, we are a solution-centered organization. We want to know the problems, but we want to be part of the solutions. And then also another program that we just instated is Our Voices Matter. We want people to use their voice. We want to hear about your experiences with the healthcare settings, and that's good and bad. If you're having negative experiences, we want to, when we're sitting at tables of influence, we want to use lived experience stories that you're having in the healthcare setting. No, we don't use your name. No, we don't. We make sure that that stays private. But we also need the positive. If you have a good experience, you have a great doctor, we want to know, because there's people looking for new doctors. So get online and tell us about your experiences. And then also Be the Match. So there is a cure for sickle cell disease, right? We do know that there is a cure. For all of y'all that may not have known, bone marrow transplant has been around for 30 years. It is not as robustly used in the sickle cell population, but thousands of people have been, maybe thousands of people have been cured using that, but it's not available to everyone because you have to have the right match. And so what we encourage you to do is to learn more about, if you're a warrior, learn more about options for bone marrow transplant and supports. And then, and you can order a free package at SickleCellConnect.com. Order one for yourself or share this resource with your patients. And then join the registry. We can have the cure, we can have it. If it's for us, it needs to be with us. We's the us, y'all. We are the us. So those characteristics that they're looking for with the best matches, sometimes people can't get a cure because there is no match in the database. So we really encourage you, make it a family affair, make it a friends group, but join the registry and be committed to helping to save lives. All right. Oh, okay. Ray didn't finish that slide.
I'm right here.
I'm human, y'all. So
and you're running a CBO, so you get all the passes, all of them.
We thank you. We thank you. We thank you for coming and sharing your expertise with us, and for sharing your passion for this topic, for not silencing your voice just because people aren't listening. We're going to continue to make this message clear until they listen, until this is part of normal conversation. I'm going to encourage my colleagues in the community based organization space, as well as my medical colleagues, to do more, to learn more, to encourage more research. That's the only way we're going to change things, folks. All right. So thank you so much. Thank you,
Ray. Thank you.
Absolutely. Make sure you subscribe to our channel so you can hear. And this video, for those who may have missed pieces of it, will be up on our YouTube channel within about 24 hours. So thank you for attending. Have a wonderful night. I'm hungry, y'all. I'm going to eat. Good
You
night.
as well. Thank you. Good
And
night.
Dr. Tomia, would you stay on for just a moment?
Sure, sure.
Thank you.